So let me just formally introduce you then. We have Tommy Manning and Devin Latremore from the class of 2013. I assume you met here at St. Michael's?
Mm-hmm.
Did you?
Yeah.
Great. And they both are healthcare professionals in Connecticut at Yale New Haven Hospital. Tommy is a physician assistant in Neurocritical ICU. I can't imagine that. But I want to hear more about it. And Devin is currently in the Pediatric ICU, but she is also going to grad school at the same time to get her family nurse practitioner certification or degree. So love to hear about that as well, and how you manage all of that, but also how you got to where you are. That'll be terrific. So without further ado, I give you Tommy and Devin.
Okay, so both Tommy and I were bio majors at St. Mike's. We graduated in 2014. We had met in biology class, but we really got to know each other doing fire and rescue. So Tommy and I were both on the rescue squad. And I originally, when I started my freshman year, I thought I was going to go to medical school. And then as time went on and I got experience doing fire and rescue, I kind of realized that I felt more like a nurse than a doctor. And to solidify that, I did a lot of self-reflection, a lot of time in Professor Bazzone's office. And
she says hello, by the way.
Oh, she does? It's been a long time. And I also set up my own internships with two family nurse practitioners. So one was in a cardiologist's office and the other was OBGYN. And I got to see what their profession was like. And then I basically reached out to every single alumni that I knew through fire and rescue who was a nurse or a nurse practitioner, and got advice from them on whether or not I should go to nursing school or do an accelerated program where you go straight through, and usually 3 to 4 years, and get your nurse practitioner degree. And almost all of them, I think, but two were like, get experience as a nurse and then go back to school. So that's what I did. So I kind of changed my mindset junior year, I would say. And then also while I was still in undergrad, I worked at a senior center. I actually forgot the name. It was in Shelburne Farms in a memory care unit. So I was doing like PCA work, which was also a very valuable experience, very eye-opening for me. And then after I graduated in 2014, I moved down to Connecticut with Tommy, and he started PA school, but I had a gap year before I started nursing school. I did take 2 classes before going to nursing school that some of the programs required, and just to kind of keep my options open, I decided to take them. So it was nutrition and I think like developmental science. They're 2 super easy classes I took at a community college. Both were online over a summer. And then I applied to probably a handful of accelerated nursing programs. I ended up going to Binghamton, which is in New York. And at the time, I made that decision because it was in state for me. And I wanted to, money at the time, I wanted to be smart, knowing that I had just paid a lot of money to go to St. Mike's. And I knew after talking to a lot of nurses, they're all like, it doesn't matter where you go to school, you do your training on the job, which now I'm a nurse, I totally get it. But the program I went to is actually very good and well known in the state. And I had a great experience, and it was a total of 12 months. After I graduated from nursing school, which you really couldn't, because it's accelerated, you really can't have a job during it. That is your job. I started my career at Yale in the cardiothoracic ICU. And this was an adult unit, which is very tough to start as a new graduate nurse in the ICU, but I have always liked things that challenged me. And I stayed there for about 2 years before I switched to the pediatric ICU. I still knew in the back of my head that my goal was to go for my NP degree. So I always had a passion for cardiology, but I also had a passion for pediatrics, and I wanted to kind of explore as much as I could before returning back to school. And I'm really glad I did, because the pediatric ICU and we can, if people have more questions, I can talk about it. It's just, it's very challenging. And my day, from day to day, it's like, can be drastically different. Instead of the adult ICUs, like Tommy will talk about, he's in the neuro ICU. So it's very specialized. Like he's focusing on neurology. And then like I started my career in the cardiothoracic ICU, I focus on the heart. But now that I'm in the pediatric ICU, one day I'm, working with one of my patients can have a congenital heart defect and my other patient has diabetes. So it's just like, it makes, you really have to like swing the way you're thinking very quickly, and it's a lot to master. So I really enjoy that. So last fall, I started graduate school. So I started my 2019. Yeah. Oh yeah. Sorry. And so in 2019, I started my FNP degree. I will complete that in August 2022. So I am still full-time at work and going to school part-time. It's about to get real spicy because I'm going to be starting clinicals this summer. So we'll see how long I can manage to stay full-time at work. I feel like I made some smart decisions along the way, and I'm glad with the choices I made because Yale does have a tuition reimbursement. So if you're depending on if you're full-time or part-time, they allot every single employee a certain amount of money. And I also applied for a scholarship, which I was very lucky to get through Yale. So I'm basically going to graduate school full ride versus Tommy's experience is a little bit different than mine. So I am glad I waited, and I'm super glad that I got the experience that I'm getting as a nurse. It's invaluable. I can't imagine being a nurse practitioner without having these years of being a nurse. And I can go on for days talking about that. But I feel like that's my story in a nutshell. I guess I'll let Tommy go, and then
you want to talk about what your average day looks like? You want to do that after?
it's up to you guys. What do you guys think?
Yeah, go. Talk about.
Oh, you're muted.
I know, I hate this. So why don't we hear from Tommy about sort of how he got to where he is, and then you can go back and you can talk about your day and he can talk about his day.
Okay, great.
Great.
So yeah, hi everyone, I'm Tommy. So my path really started when I first got to St. Mike's. I knew I wanted to be a biology major because my two interests were either healthcare or marine biology. And so my first couple of years, I really dove into those two fields to try and figure out what exactly I wanted to do. So I worked at, the summer after my freshman year, I worked at the Mystic Aquarium and had an awesome experience there. I also joined the rescue squad at St. Mike's. And when I actually got in the field on the ambulance doing actual patient care was when I realized that healthcare was the route for me. From there, I had to decide what I wanted to do. I wasn't hadn't decided yet like Devin had, even though she ended up changing her path. So I, just like Devin did, took advantage of some of the connections that we had and shadowed a lot of different people. I shadowed, PAs, nurse practitioners. I talked to a number of paramedics who were graduates of the program, physicians, and then nurses in order to try and figure out what I wanted. And ultimately, PA seemed the best route for me. So after PA school, I actually wanted to apply as early as possible to get into PA school. I knew it was another 2.5 years of education, and wanted to jump right into that. However, you need a good amount of clinical hours in order to do that. And so, the rescue experience definitely helped with that. My senior year, I also started working through, it's now UVM Health Center, but it was Fanny Allen before, in their walk-in care, in order to get the number of hours that I needed to be competitive, and was lucky enough. Looking back, I don't know if I would have been as lucky if I did it now, but I was lucky enough to get into a program at Quinnipiac University and accepted the position and started pretty much right after, I finished my classes at St. Mike's in the winter of 2013. But if I had done that last semester, I would have finished the weekend before PA school started.
Oh boy.
And you really, I had a couple of classmates who did that, who had, no break at all. And you really jump right in with PA school. It's fast paced. There's a lot of material to cover. Most of the programs are set up where it's a year or so of didactic. So it's classes, and it's pretty much full time. None of my classmates were able to work. Some of them would do, per diem job like one weekend a month. However, it's very intensive. So you do your year of didactics and then you do a year of clinical rotations. And in total, it's between 2 to 2.5 years, depending on the program. Once I kind of completed that, I was looking at jobs kind of all over. I liked higher acuity things like the emergency room and the ICUs. I also really enjoyed a couple of my outpatient rotations like pediatrics and a general neurology office that I had rotated with. And so when I found the neuro ICU position, it was kind of a good mix of the critical care and the neurologic care that I really enjoyed. And so I applied. I've been there for 4.5 years. The team has really expanded. When I was first started, I was the 6th. We call them APPs at Yale because PAs and APRNs essentially work the same or do the same type of work. In Connecticut, legally, they have the same scope of practice, and at Yale, they're treated as equal. We call ourselves APPs, but there are 6 APPs. Since I've started, our unit has almost doubled in size as far as census, so the number of patients that we see on a daily basis, and then our team has also more than doubled, where we have 13. We're hiring for our 14th team member. So, it's been a really, great ride, I would say. It was very fast. I don't know if, like I said, I would be able to do it now, but because a lot of the requirements have changed, PA school has gotten more competitive. Not to discourage anyone, but the clinical experience is really the main part of the application. And so I encourage people to get any healthcare profession, get as much clinical experience and shadowing as you can. And then, I've been lucky that I landed a job that, I enjoy and still challenges me every day, and where I'm always, continuing to learn new things.
Oh, those are great. Great. Thank you so much for doing that. Maybe we'll see if there's a few questions just about sort of that background time and see if anyone has any specific questions. You guys can send your chat to me, or you can see if you can unmute, but anybody have a question for either Tommy or Devin?
Don't be shy.
Well, I have one.
Yeah.
So what was it that you were actually doing at Fanny Allen then when you were there, when you got that job?
Oh yeah. So I was essentially an emergency room technician. So they had the main emergency room at the UVM campus, and then at Fanny Allen, it was kind of a smaller branch. It was kind of a cross between an urgent care and a emergency room. And what I would do is greet the patients, bring them back, take their vitals, do an initial assessment, and then kind of report as a medical assistant. I would report to the providers or the nurses, where they would continue to do things. And then to do the workup, to order tests. And then occasionally I would do small procedures. I would splint fractures. We would, if someone had ear problems or ear, nose, and throat problems, we're responsible for a lot of the irrigation. So rinsing the problem away. As far as more invasive procedures, the suturing and everything, that's all more on the providers. But the splinting and things, we were, once we were trained, we would be doing that independently based on the type of splint that the provider, told us the patient needed.
Okay. So we've got a couple of questions. One is, which classes at St. Michael's did you feel were the most critical or most helpful, most important? I know, Devin, you said you took a couple of classes afterwards. We now offer nutrition, so that's something students can take now, as well as epidemiology and, health and infectious disease. So we've really broadened the curriculum quite a bit, but so what classes were most valuable?
So I would break it down into two different categories. So the ones that you're going to need for application to a healthcare field, like the prerequisites, and that's going to be your general biology, your general chemistry. Most of them require physics, stats. Some require biochem, orgo.
Yeah.
On top of that, there are certain classes that, I really enjoyed, and I think personally either influenced my decision or going to healthcare, been really useful. One of those was pathogens and parasites with Professor Loisel.
Sure.
Microbiology was also very important because there's a lot of obviously bacterial infections and things that you have to treat, and knowing the structures of the bacteria is helpful with determining what antibiotics to use. But yeah, go ahead.
Okay. What about you, Devin? You didn't say senior seminar, Tommy.
Oh, I loved my seminar. I loved it.
Mine was on invasive species. So
I
it's a little
remember.
bit outside.
Yeah, okay.
Realm. It was still very interesting.
Of course.
To be honest, it's like really hard to say one class, because I know everyone's nervous when you're in undergrad and you're thinking like, I know at the time people like in our grade, or our class, they were so worried about anatomy and physiology, because I think at the time it was called comparative, right?
Yeah, right.
Everyone was like, oh my gosh, it's not human, and I want to go to this. At the end of the day, what you take away from St. Mike's is not going to be what you learned week 3 of cell biology. Half of it that I've taken with me as I've gone along is work ethic. Like your professors at St. Mike's, and I can say this because I've now been at 2 other universities since St. Mike's, nothing compares. I handed in my first paper in nursing school, and literally the professor wrote like a paragraph at the end of like how excellent this paper was. And when I submitted it, I was embarrassed. I'm like, I know this is probably the worst work I've ever submitted, but I just like didn't have the time and whatever the situation was. But it's just like the standards are so different. And I learned at St. Mike's to challenge myself. My professors challenged me. They expected a lot out of me. So I learned how to study. I learned how to research. I learned how to present. Not that I'm presenting well now.
That's great.
It's like the major takeaway. It's like even in grad school now. So I'm with a group of, my classmates are from all over, and still over half of them have no idea how to find a good research article.
Wow.
And so it's like, it seems crazy, but once you start to compare yourself to others as you go on, it's not going to be what you learned in Gen Bio. It's going to be the standards that you were held to, how you value your education. It's not always about content, I guess. Like, don't dwell on, am I getting all the content to succeed? Because half of it is whether or not how much effort you put in to succeed. You're going to, no matter what you do.
Well, you've answered another one of the questions I received, and that is, how well prepared did you think you were? And it sounds to me as if you both felt you were very well prepared.
Yeah.
Great.
Yeah, I mean, it was definitely a shift going from undergrad to grad school.
Sure.
And the volume and kind of density of information was significantly, increased. But yeah, I think the work ethic, the study habits that we developed at St. Mike's. I mean, Devin was always better at studying than I was. So I would put it off to the last minute or something. And then, as I went through junior and senior year, I started being a little more proactive about, schoolwork. And then with grad school, you can't let that happen. If you fall behind, you're just going to get swamped. And so,
Yeah.
a lot of that stemmed from, wanting to succeed at St. Mike's and having, getting those resources that you need in order to develop those good habits.
Yeah, I also felt very well prepared. The content obviously is different. Like when he went to PA school, nursing school, we were taking classes that we had never taken before, right? Because now we're focused on humans alone and everything medical.
Yeah.
So it's different, but it like I said, I don't think it really matters because we applied how we studied and to whatever you're getting taught at the time.
Mm.
But a big thing I would say is like writing. I learned how to write at St. Mike's. I learned how to research at St. Mike's. Like it's like funny. I feel old, but like you'll look back at like labs that you did and it's you remember so much more from St. Mike's than what you would think.
Well, that's a good, we like to hear that. So that's great. Let me go through a couple of other questions. So one student asks about patient hours and how, I think you probably know, it's much more difficult to find those opportunities now.
Yeah.
I know Paul or Dagan, one or maybe both of them sent out something recently about how to get that experience even with COVID and the competition and so forth. And they're both here. So maybe one of them could, I don't know if you have anything to say from your perspective about places people can look or how strategies.
So be creative and you'd be surprised that the more people you reach out to. So so the 2 internships that I set up on my own, I reached out to like family friends who then were like, oh, I know a woman who's been a nurse practitioner for over 25 years. I think she'd be willing to take you on. Then I reached out to her and it was like super easy to set up. So then I did it on my own and I called a bunch of offices saying, I'm a student at St. Mike's. I'm really interested in healthcare. I would love to shadow you, and I tried to like not make it as if it was going to be like super labor intensive for them. So I'd go like every Friday, alternated between the 2 and just spent the afternoon with them. Also, another idea too is, like I said, I used to do PCA work. I know Vermont has to have some type of agency because I know one of our friends used it where they have PCAs come either into their home, usually into their home, and they're assisting them at home. You can also use hours like that. So just think outside the box. There's more opportunities than just working at a hospital and or doing fire and rescue. Because I think some people think we're students there. It's like, well, I'm not on the, I don't do fire and rescue. So there's no way I'm going to get